Hi, I'm Dr. Brenner with Boston Vision. I'm one of the ICL surgeons here, and I'm here with one of our doctors and a patient, Dr. Pham.
Yeah, hi, I'm Dr. Linda Pham, and I'm from Boston, Massachusetts. I received my doctorate of optometry at Nova Southeastern University in Fort Lauderdale, and I completed a residency training at the West Haven VA in Connecticut, and I've been with Boston Vision for about a year now.
Awesome. And so what made you decide to, get your eyes fixed, if you will?
So I've been doing refractive surgery co-management for about a year now, and a lot of my post-op ICL patients are incredibly happy. Most of them have very high prescriptions like myself. And just with the latest EVO ICL technology with the port, I am very comfortable about getting that procedure.
And so you've been seeing LASIK patients, PRK patients, ICL for the last year. What made you say, you know what, ICL is the right thing for me?
That's a great question. So I actually was never interested in LASIK or PRK just because with my high prescription, I knew that a lot of corneal tissue needed to be removed. And with ICL, I know that it's removable in the event that my prescription changes or if I needed cataract surgery in the future. The fact that it's removable is very appealing. And also it's minimally invasive and it's a quicker recovery time than LASIK and PRK.
So, you said ICL is the thing for me. What were you most concerned about going into surgery?
Honestly, I wasn't very nervous or anything like that, but my biggest challenge before surgery was just staying out of my contact lenses for a week or so, just wearing my glasses that were very thick and heavy. But I didn't really have any expectations going into surgery because it was my first surgery ever.
Yep. It's funny when I talk to people about surgery and I go through the whole thing and then I say, oh, but you need to stay out of your contacts so we can get a good measurement. They're like, oh, what? No, I can't do that. So you're right. Sometimes that is the hardest part. All right. So you had surgery and, what was your vision like the next day?
My vision was 2015, which is better than 2020 in the right eye and 2020 in the left eye. It was incredible, just waking up and being able to see.
When you compare what you thought surgery was going to be like to what actually happened, what were the differences?
I thought that I was going to, see instruments coming towards my eye, but honestly, I didn't really see anything besides just lights. It was painless. It was really quick. I felt like I was only in there for 10 minutes or so. It was over before I knew it.
And what do you plan to do with your new visual freedom? How has life changed for you?
It's changed quite a bit. So, I've worn really thick glasses since I was 5, worn contact lenses for over 20 years, and now I don't even have to think about contacts or glasses, and I'm a very active person. I like the outdoors. I like to hike, camp, go to Alaska every year. I do martial arts, kayak, rock climb. So I'm excited to do all of those things now.
Great. So what advice would you give to patients out there or doctors that are looking to refer their patients to a practice? What should they look for in a surgeon in a practice that does ICLs?
I think it's really important to do your research. Obviously, you're trusting your eyes, you're trusting the surgeon with your eyes. So it's important that the practice and the surgeon is experienced and they've done a lot of ICL surgeries. And it's important that you ask a lot of questions during your consultation so you know that what you're getting into.
So what makes Boston Vision unique when it comes to doing ICL surgery?
I would say that Boston Vision does their ICL surgery in-house at our main location in Brookline. They're very flexible with your schedule and they help you at every step of the way. And I also want to thank you for taking great care of my eyes and doing my ICL surgery.
You're welcome. I'm just glad everything really worked out and that you're seeing well. And that's the beauty of the ICL is that the outcomes are great. So it's easy to offer something when the patients do great. So if you're interested in ICL, go to bostonvision.com and you can make a free consultation and we'll tell you if you're a good candidate.